Hello friends, welcome to FastCoder 21 Medical Coding YouTube channel. The motto of FastCoder 21 is to share knowledge, gain knowledge. If you are visiting for the first time, click on subscribe button to receive future updates. FastCoder 21 YouTube channel is useful for inpatient coding, outpatient coding, surgery coding, anesthesia coding, dental management coding, and HCC coding. And also you will receive latest updates about AAPC, AHIMA, and CMS. Please watch until the end to gain more in-depth knowledge about proposed session. So today we are going to learn 2023 Emergency Department Evaluation and Management Guidelines using scenarios. As all of us know, there is no distinction between new and old or established patient in emergency department, which is the golden rule which we are using for the previous years. So 2023 E&M guidelines to ED includes existing principle that there is no distinction between new and established patients in the ED. In the emergency department, there is no difference between new and established. Yes, in order to code evaluation management, both new and established are same. So while coding evaluation management in emergency department, we will use same code for newer established patient. So these codes will be used by physicians and QHPs. QHP means qualified healthcare practitioners other than just the ED staff. So anyone using these guidelines will code emergency department evaluation and management coding. As all of us know, emergency department evaluation management coding depends on medical decision making. So previously we have, if you take 99281, it has straightforward decision making. And in 2023 may not require physician or qualified healthcare professional. So in order to code 99281 in 2023, there is no need for physician or qualified healthcare professional. Only nurse or nursing staff is enough to code 99281. So if you take 99282, previously it is low medical decision making. Now in 2023, it is straightforward medical decision making. 99283, it is previously moderate. Currently in 2023, it is low. 99284, previously moderate, no change. In 2023 also same moderate, there is no change. In 99285, previously high, no change. And 2023 also there is no change. So basically there is no change in 99284 and 99285 with comparison to previous years medical decision making. So here we will learn the 2023 definitions for ED E&M codes 99281 to 99285 or 99281 ED visit for the E&M of a patient that may not require the presence of a physician or other healthcare professional. So basically, in order to code 99281, patient does not need to be seen by the physician. If the nursing or nursing staff will see the patient, they can code 99281. So if you take 99282, ED visit for the evaluation management of a patient which requires a medically appropriate history and examination and straightforward medical decision making. So previous years it is 99282 is having low medical decision making, but in 2023 it is converted to straightforward medical decision making. If you take 99283, it is having low medical decision making. 99284 and 99284, there is no change in the medical decision making. Like if you take 99284, it is having moderate medical decision making. If you take 99285, it will have high medical decision making. So these are like 99284 and 99285, both are common in 2021 as well as in 2023. So here 2023 documentation guidelines changes do not impact the critical care codes which are 99291 and 99292. So basically using these latest guidelines there is no impact on the critical care codes. So we can code critical care codes as usual using that time. So here we have few rules in order to determine ED E&M service level. So medical decision making will determine ED E&M service level. So latest or in 2023 based on medical decision making we will determine the ED E&M service level. So second one, history and exam are required only as medically appropriate. So even though we will not use history and physical in 2023, but physician needs to mention as medically appropriate. In 2023, the prior requirements to document E&M service in the ED based on complete history, physical examination and MDM have been removed. So in 2023, there is no need for complete history or physical examination in order to code ED E&M services. So next one, the new guidelines simply require a medically appropriate history and physical exam, which makes MDM the sole factor for code selection in 2023. So only medical necessary history and physical exam is enough. No need for complete exam, and MDM will be the sole factor for code selection in 2023. So as well as MDM will still be based on the modified historic 3 MDM components which are as follows. First one is number and complexity of problems addressed. Second one is amount and or complexity of data to be reviewed and analyzed. And third one is risk of complications and comorbidity and mortality of the patient management. So these MDM elements are same in 2021 and 2023. There is no change in MDM element in ED. So how do you level in 2023? In 2023, the highest two of three components of MDM will be used to select the level of an ED E&M code. So we need to select highest level up among three components, like highest two of three components of MDM will be used to select the level of an ED E&M code. So the level of MDM concept will not apply to code 99281 since this level of service will not require the presence of physician or other qualified healthcare professional. So basically this 99281 does not need MDM concept as it will be performed by nursing staff. ED&M services and critical care services may be repeated together. So whenever there is necessary, we need to code ED and E&M services and critical care codes along with ED services. So we can code ED and critical care services in the same encounter. Next, nursing staff may report 99281. So to report 99281, nursing staff will need to ensure documentation of the service performed and clarify that the work they performed is not part of another separately reportable services. So code 99281 could be reported for removal of suture materials, dressing change or any other separately reportable services if the provider is not reporting an E&M service during the same encounter. So in order to code 99281, whether physician or nursing staff will code 99281. So if the physician uses 99281, nursing staff will not use 99281. So as usual, time is not a factor when choosing the E&M levels of service, but we can use time as a factor for coding critical care services. Next one, medical necessity. The physician or qualified healthcare professional will have to consider whether the nature of the presenting problem supports the medical necessity of services rendered. So we need to check the service provider services as well as the presenting problems. So medical necessity will be the predominant criterion for selecting the level of ED E&M service. Next one, critical care and emergency department services may both be reported on the same day when after completion of the emergency department service, the condition of the patient changes and critical care services are provided. As we learned previously, we can code both emergency department services as well as critical care services on the same day. So we have an example scenario here. The patient is a 26-year-old male, was biking and collided into a wall. He fell off his bike onto the cement. He presents to the ED with minor lacerations on his legs but no other complaints of pain. The nurse examines the laceration and determines that the simple wound care is warranted and this patient does not require an examination by the physician. How do you code this scenario? So basically here our answer is 99281 as here the treatment is provided by the only nurse. Physician does not require an examination by the physician. So patient did not see the physician or physician no need to see the patient. So here only nurse examined the patient and provided the treatment. So here we can code 99281 based on 2023 E&M guidelines. Thank you guys. Thanks for watching Passcode 21. Please like, share, comment and subscribe. Happy coding guys.